Today is our annual Disaster Day simulation, a partnership between Texas Tech University Health Sciences Center and Texas Tech University School of Veterinary Medicine. We are simulating a natural disaster, in this case a wildfire.
And you're going to learn some things today that you perhaps didn't know about another. From mistakes being viewed as puzzles to be solved and not crimes to be punished. And that's really the whole goal of letting learners know that today is the opportunity to learn from each other and perhaps make mistakes. It gives them a chance to at least have one experience under their belt or multiple experiences under their belt.
We've got students coming from all different professions, both on the human side and in the veterinary side. So recognizing that this opportunity creates an environment and a scenario where our students are learning from one another across different disciplines and professions, and then thinking about the community of Amarillo and the northern Texas Panhandle and some of the recent news events that have been happening with the brush fires. This is a real-time, in-the-moment, applicable, relevant scenario that is going to provide real value to our students.
Like when you have a lot more people.
We have the Red Cross, we have Amarillo Fire, we have Amarillo EMS Services, we have emergency management teams. We even have teams coming from other counties to train students. So we all such value communities coming together, teams coming together, that we involve everybody.
Get these folks out of here, come on! Our station was the rec trailer. It is fairly common to have that type of problems. So know what to do. What is your role? How you manage your team? How you assess your patient? What is the best way you can actually do and prepare the people around you? And the only way you can do that is when you replicate a situation when you have control of it, which is in this case, these fake horse that we have here. So I can tell them what to do, how to do it, and move around every single aspect of that task. So that gives you confidence, and by the time comes, you are ready to perform at your peak.
This is my first time doing this, and it was fun being able to apply what I learned in school to like a real world application that's not just in sim lab, but to actual people. And I think any way that we can have more chances to work together, even with people of different disciplinaries, it's really helpful in every single way, just because you learn new ways to communicate with people that you're not used to.
Front legs aren't much.
So working with the pharmacy and nursing students was phenomenal. They were super interested in what we were doing here. We were super interested in the knowledge that they brought to the table. It was very easy to learn from them when we all have the same goal in mind, and it's to just make sure everyone at the disaster is taken care of.
Today I was playing the role of a hired hand that works on a ranch that was involved in this fire situation. This exercise is one of collaboration, and so you could really see that happening today.
It's out here to help, and
this event has helped me in my communication skills, being able to communicate not only with people in different professions, but also just being able to communicate better with the patient and have a deeper understanding for the patient, as well as a deeper understanding of others in different professions.
So last year I was a first year in vet school whenever I first did all this, and I was blown away. Last year I actually had the same case for the triage station as I did this year, and I had no idea how to handle that last year. This year I was able to go in not knowing it'd be the same one, but once I saw it I was able to better collect myself. Just being able to pull on the previous experiences that I've had throughout this past year of communication was very valuable.
I think what we want them to recognize is that in a time of crisis, it's all hands on deck. Being able to be on the same team with the same objectives in mind of triage control and making sure that the response supports the individuals that are affected. We're really hoping that our students can see how they can learn from one another, and that by working together, they're able to create an environment that supports the community in a time of need.